The doctor has collected a lot of information about her depressed patients. The CBIS assessment screening interview and the problem and resource lists that the patients completed have given the doctor a good idea of their diagnoses, major issues, and strengths. She has put them on appropriate medications, and it's time to follow through with treatment plans and focus on helping them develop skills. Jan is coming in today for an appointment. The doctor sees from the problem list action plan that Jan would benefit from activation skills. She needs to get up off the couch and moving, otherwise she'll continue to cycle downwards.
Okay. So Jan, one of the things that I know you've been struggling with is how depressed and withdrawn you've been feeling. And a lot of the problems that we sorted out in the action plan and that problem list organization really fell under the activation heading. So looking at the activation, I took a look at the activation activities. And one of the things I was attracted to was this antidepressant activities chart. Take a look at it. See what you think. So you can see that it lists basic activities of daily living, sort of the things you would ordinarily during the day.
You want me to do all these?
Good question. Good question. No, not at all. I just want you to take a look at it with me right now.
Okay.
And just look at the chart. It's got the list of them, and then it has the days and boxes.
Okay.
And what I'd like you to do to create a kind of a baseline for us so we get an idea of the activities you're doing right now is to check off in the appropriate box any of the activities you're doing for the next week. What do you think of that?
So you want me to just check off the things that I do, not do everything?
Exactly.
You want me to do this every day?
Well,
all these checks?
What are the chances of doing that from 0 to 100?
Maybe 50%? 50-50.
Okay.
If the patient estimates a success rate of 75% or more, that's a good sign. If less than 75%, then change the goal to a smaller, more manageable one.
So I want to make it more likely that you'll be successful here because that's really important to both of us. So what if you did it every other day and maybe put this on the fridge so it'll be kind of obvious to you?
Every other day?
Yeah.
And I don't have to do anything, I just have to check it off.
Absolutely, exactly.
I could do that.
Okay, I think that's great. Good show.
Okay.
Scheduling a follow-up is really important. Jan arrives late one afternoon in a panic.
Hello, Dr. Weinerman here.
Jen Stretch is here. No, she doesn't have an appointment. She's quite distressed.
Okay, do you think you could give me 5 minutes? Great. Thanks a lot. Bye-bye.
The CBIS manual makes it easy to use on the fly. Clearly, Jan needs to calm down.
Jan, I know and I can see that you're experiencing a lot of anxiety, but it'll be all right. Okay, I want you to practice a technique with me that I'm sure will help you settle, and I'm going to do it first. Actually, why don't we do it together, and then you can kind of practice it at home as well, okay? So put your feet just like that. Put your hands, one hand on your chest and one hand on your belly. Now, I want you to take a very deep, slow breath right into your belly so that your hand pushes out, okay? Let's go. Now hold it there, and then blow out slowly. And hold it there. Then in, and hold it there, and then out. And hold it there. Push it out just as if it was a balloon expanding. And now out. Blow out and hold it there. Can you feel yourself relaxing? Hold it there and blow out. letting it collapse. Okay. One last time. Perfect. Now you can feel how you've settled down. Now doing that kind of breathing actually stimulates your parasympathetic nervous system that slows your heart rate and helps settle you down. Okay? Easy technique. You can use that whenever you get anxious like that. Do you think you can practice that at home too? How are you feeling?
I'm not so shaky. I was having a hard time breathing.
Right. The problem there was breathing shallowly and quickly, and what we did is deep breathing into the abdomen, pushing it out like a balloon, holding it, then blowing out and holding it. Deep, steady breathing.
I was getting dizzy.
Right.
Okay.
Okay. Good. It's nice to know you have control over something like that. Great. And that's one of the relaxation skills that we've got to use.
Okay. So
Great.
thank you for seeing me.
No problem. No problem.
So I'll practice. You want me to practice this at home and then I can come back?
Yes.
Okay.
There is a third way to access skills, and that's through the patient profile. Some patients like to find out what kind of interpersonal style they have that makes them prone to depression.
Hi, Susan. I
Oh,
made
hi.
these. Would you like one?
Thank you. You're always bringing stuff in. There is a self-assessment questionnaire which categorizes people into overthinkers, perfectionists, or pleasers.
So Jan, your self-assessment questionnaire, thank you very much for doing it and filling it out. What it shows to me is that you fit the overthinker picture, okay? And we kind of know that. We know how much you think about things and
Yeah, not good things.
yeah. So what this leads me to is the self-assessment profile of an overthinker. So take a look at that. Does that look familiar to you?
Yeah.
Person ruminates, predicts negative outcomes, self-blame,
Withdraws.
withdraws and socially isolates,
Blame my boss.
may blame others or the system. Yeah. And the feelings that go with it. Hopelessness, gloomy, feeling alienated, depressed, maybe angry.
That sounds like me.
Yeah. So let's look at this final column. These are simple strategies that a person might use to get them started on the road to recovery. So take a look at them and see if there's any one of them that you might want to start with, that's just a kind of small first step. What do you think? You're smiling. It's
That
nice
says-
to see you smile.
Practice smiling at people.
Very good.
Stop watching the news.
What do you think of that? Tell me a bit. What news do you watch?
Is CNN news?
CNN is news. It's pretty negative news, and it repeats itself.
So I've just got it. I don't watch it all the time, but I've just got the channel on all the time.
So, well, what we want is something that is a very small first step. So if we were to...
The profile handouts have suggestions for activities that help patients deal with their depression. This may lead to negotiating further goals with the
I
patient.
guess I could put it on something else.
Let's put numbers on it to try to really pin it down.
So stop watching the news. So, like, not stop 100%. I can watch the news.
I think that would be too much to ask. Yeah, you can watch the news.
So if I watched the news like twice a day, like dinner time and nighttime.
Do you think that's too big a step, or do you think that's something you could actually do?
For a week?
Okay, for a week. Do you think you could do that until the next time we meet?
I could try.
So what are the chances that you might actually be successful at that? Let's say from 1 to 10.
Maybe 7 or 8.
7 or 8?
Because I have to
Okay.
come back and say I did or didn't
You
do it.
do. You do. You know me. So, I'll buy that. I'll buy a 7 or 8. That's a very good chance that you'll actually do that. So, okay, so we've got a kind of a deal. So
Okay.
that's the part you're going to play.
Okay.
All right.
When you've made accurate diagnoses, learned about your patient's problems and resources, and have worked with them on CBT skills, they will feel that they are understood and engaged in a partnership designed to give them the best possible outcomes.